Hello, my name's Marcus. I'm a final year medical student from the University of Notre Dame, and today I'll be presenting my research on the methods for the identification of informal carers in the healthcare system. So most of you will know who a carer is. It's someone who's providing ongoing, sometimes paid, sometimes unpaid care and support to a person who lives with disability, chronic illness, or the effects of aging. I'm sure you're also aware of informal carers, who are a type of carer who has an existing relationship to the person they're caring for. And this can be a family member, friend, or neighbor. Now, these informal carers typically view the care that they're providing as an extension of their existing relationship, and therefore don't typically self-identify as a carer nor identify their need for help and assistance. 1 in 10 Australians are informal carers, and the care that they provide is in excess of $77 billion annually. The importance of identifying informal carers and offering early support from a healthcare perspective is that it improves a range of patient and carer outcomes and minimizes repeat presentations to the hospital. So the aim of our study was to evaluate methods for identifying informal carers in the healthcare setting. So we performed a systematic review and found 6 papers. Now, the studies that we found were predominantly conducted in Anglo-Saxon countries, including France, Australia, USA, and Scotland. Interestingly, there were a range of terms used to describe informal carers between these studies, including dyad, young carers, isolated carers, and hidden carers. Additionally, the definition of informal carers varied. So criteria may have been taken from the Royal College of GPs in Scotland, the New South Wales Carers Recognition Act, or using very specific survey criteria or assessment of electronic medical records. So there were 3 main methods of carer identification. Surveys were mainly used to identify carers in the community, whereas electronic medical records and multimodal intervention-based approaches were used to identify carers in the medical setting. So we found that all methods improved informal carer identification. So in the multimodal study that we identified, which is shown in the blue box, this was an educational and awareness intervention, which took place at 4 GP clinics in Scotland. And this incorporated searching electronic medical records, displaying posters in the clinic, and opportunistic screening by clinicians. The clinics that were involved in this study all identified more informal carers at the end of the study, or they improved the accuracy of their informal carer records. An improvement in informal carer identification was also seen in a study which was investigating methods for improving the accuracy of carer information held on electronic medical records at an inpatient cancer service on the Central Coast. And this study is in the red box. So over the duration of the study, which consisted of an electronic medical record audit, there was an increase in accurate information from 13% to 34%, which the authors attributed to, in part, a general increase in clinician awareness about informal carers. So the immediate implication from this review is the importance of clinician education and awareness in informal carer identification. There is not yet a best practice for identification, but this evidence seems to suggest that education and awareness does show improvements in identification. So this may have implications for clinician training to have more emphasis in asking patients about the assistance that they require for activities of daily living. Future studies will also benefit from exploring the development of a consistent terminology and definition for informal carers, as well as methods for connecting informal carers to support services after they've been identified. That's the references which were referred to throughout this presentation. Thank you for your time. If you have any questions, my contact details are listed on the slide there, as well as the contact details of my collaborator.